Hello, my name is Garvin. This video is on the measles. So what are the measles? Measles or rubella is a viral infection of the respiratory system. Measles is a very contagious disease that can spread through contact with infected mucus and saliva. An infected person can release the infection into the air when they cough or sneeze. The measles virus can live on surfaces for several hours. As the infected particles enter the air and settle on surfaces, anyone within close proximity can become infected. Drinking from an infected person's glass or sharing eating utensils with an infected person increases your risk of infection. Measles is a leading cause of death in children. Of the 115,000 global deaths related to measles in 2014, the World Health Organization reported that most of the victims were under the age of 5. So contact your doctor immediately if you suspect you have measles. If you have not received a measles vaccine and you come into contact with an infected person, visit your doctor to receive a measles vaccine within 72 hours of contact to prevent infection. You can also prevent an infection with a dose of immunoglobulin taken within 6 days of contact with an infected person. So what are the symptoms of measles? Symptoms of measles generally appear within 14 days of exposure to the virus. Symptoms include cough, fever, red eyes, light sensitivity, muscle aches, runny nose, sore throat and white spots inside the mouth. A widespread skin rash is a classic sign of measles. This rash can last up to 7 days and generally appears within the first 3 to 5 days of exposure to the virus. A measles rash, which appears as red, itchy bumps, commonly develops on the head and slowly spreads to other parts of the body. So who's at risk of developing measles? The number of measles cases has significantly dropped in recent decades due to immunizations. However, the disease has not been completely eliminated. Measles primarily occurs in unvaccinated children. Some parents choose not to vaccinate their children for fear that vaccines will have adverse effects on their children. Most children and adults who receive a measles vaccine do not experience side effects, but in rare cases the vaccine has been linked to seizures and deafness and coma. It is important to note that these serious side effects from the measles vaccine occur in less than 1 out of every 1,000,000 doses of the vaccine given. Some parents believe that the measles vaccine can cause autism in children. However, numerous studies have proven that there is no link between autism and immunizations. A vitamin A deficiency is also a risk factor for measles. Children with too little vitamin A in their diets have a higher risk of catching the virus. So diagnosing measles. Your doctor can confirm measles by examining your skin rash and checking for symptoms that are characteristic of the disease, such as white spots in the mouth, fever, cough and sore throat. If they are unable to confirm a diagnosis based on observation, your doctor may order a blood test to check for the measles virus. So how do you treat measles? There is no prescription medication to treat measles. The virus and symptoms typically disappear within 2 or 3 weeks. However, your doctor may recommend paracetamol to relieve fever and muscle aches, and rest to help boost your immune system. Plenty of fluids, 6 to 8 glasses of water a day, and a humidifier to ease a cough and sore throat, and vitamin A supplements. Complications associated with measles. It is important to receive a measles vaccine because measles can lead to life-threatening complications such as pneumonia and inflammation of the brain, which is encephalitis. Other complications associated with measles may include ear infection, bronchitis, miscarriage or preterm labour, decrease in blood platelets, blindness and severe diarrhoea. So if you have any questions, you can contact me through the website, email me or call into Lynch's Pharmacy in Douglas. Thank you for watching.